Hello, and welcome to When Docs Talk. Thank you for joining us today. I'm Dr. Adidiang Ipe Apo, and I want to welcome you all to our third show, Sex, Love, and Dating in the Age of Coronavirus. I want to tell you a little bit about us. For those of you who are joining us for the first time, we are When Docs Talk. We are a collaborative of emergency practitioners and providers. We have nurses, we have emergency doctors. We're based here in Atlanta, but we come from all around: Miami, New York, Georgia, Jamaica, you name it, we're there. We are here to discuss topics that are pertinent to healthcare, but also outside of the scope of healthcare from the perspective of emergency practitioners. And we decided to start with COVID-19 because that's kind of what was on everybody's mind. That's the world we're living in today. That's what has guided a lot of how we're living in this world. There's a lot of information out there about how it's spread, how you get it, the stats and numbers, and we recognize that you can Google that or look elsewhere for that. We wanted to be a little different. We wanted to talk about how we're living with it. How are you living with COVID-19? How has it changed your world, or not, for that matter? So one of the things we wanted to talk about is sex and touch, intimacy in general, and that's what's the subject matter for today. Now, we have people who are scared to death to touch each other. We have even leading health experts saying that maybe things as simple as a human handshake are now a thing of the past. And so we want to explore your comfort levels. We want to know what you're doing. Are you touching? Are you not touching? We actually conducted a survey of almost 200 men and women, single and married, to ask them how they feel about dating, how they feel about touching, and all of those things. And during this episode today, we're going to reveal the answers, many of which you all filled out. So I'm sure you're curious to know how your colleagues and neighbors are thinking. But I want to switch gears just a little bit. We planned our show centered on a topic that's been on many people's minds: what's going on behind closed doors, what's going on in people's bedrooms. But we can't really do this show without talking about what's going on right now and taking a moment to reflect on what our country looks like right now and how we're feeling. And I can tell you that we at When Docs Talk are extremely upset and deeply moved by the legions of Black men and women who have been killed for no reason. We contend here that it must stop. And so, even though we're talking about touch and human relations today, we want to let you know that we have planned a special episode on June 13th where we're going to talk about the intersections of racism, medicine, and the law. We want your opinions. We want your feedback. We just want to know how you're feeling. Even if you don't have solutions, just tell us what's on your mind. That's the 13th. So I hope you join us then. But right now, I would like for you to join us in a moment of silence for George Floyd, Ahmaud Arbery, and all of the men and women who have lost their lives senselessly. Just take a moment with us, please. Okay, thank you for that moment of silence. We are back. Once again, if you're just joining us now, you've joined When Docs Talk, and we are here talking about coronavirus and intimacy. But before we get started, we got to introduce our co-host here. We have a bunch of lovely ladies who want to tell you a little bit about themselves. For those of you who are joining, I already introduced myself. I'm Dr. Adidiang Ipe Apo, hailing from MIA, Miami, Florida, by way of Nigeria. Thank you all for coming.
I'm Natasha Morgan from Brooklyn, New York, by way of Jamaica, I would say. Jamaica parentage. Glad to be here. Glad to be a part of this project.
Hey, ladies, ladies and gentlemen, excited to be here for our third episode here on When Docs Talk. I'm Liz Ladare from Baton Rouge. Been in Atlanta so long, I might start saying I'm from here. Excited to be here.
Hello, everybody. My name is Davita. I am an ER trauma nurse. I'm originally from Memphis, Tennessee. I've been in Atlanta for 10 years, so I might as well, this is my new home.
Hi, I'm Sonia, Dr. Sonia Pinson. I was born and raised here in Georgia, born in Atlanta, raised in Peachtree City, and proud Navy veteran, family medicine certified, but work in an ER setting. But just feel blessed to be here today and looking forward to this great and engaging conversation we're going to be having today.
Good evening, everybody. My name is Tawny Jackson. I am a travel emergency physician, Jamaican by birth and parentage and growth, but I lived in Atlanta for a very long time. And so I am also in the process of claiming Atlanta as my home. I think we're going to have an awesome segment today. Can't wait to get into it.
I agree with you, Tawny, and thank you all for hosting and introducing yourselves to our audience. Let's just jump into it. What do we know about the coronavirus? We just want to do a very brief update on where we are right now. It may feel like it's over, ladies and gentlemen, but let us not fool ourselves. It's not. It's still here. We have to learn to live with it. So let's talk about where we are now.
Yeah, so these numbers are getting so big that they're hard to conceptualize, but there's been almost 6 million cases in the world, 6 million people that have contracted coronavirus. Over 350,000 deaths. Here in the United States, we have about a third of those cases. 2 million of them are here in America, and we've crossed that milestone of 100,000 deaths in the United States. This is just in 3 months.
Okay, and this is just some CDC updates. So right now, the percentage of new cases, they feel like they're stable and decreasing overall nationally, but we do recognize and that we are seeing that there are some areas that is still rising in certain regions, which includes the Southeast and the Pacific Northwest. And still some factors that we know that contribute or factors that are contributing are changes in the healthcare seeking behavior and increased practices and social distancing. So people have been doing a good job in doing that. And then also potentially some limiting ER visits to severe illness.
Okay. Well, every time you come, we got to quiz you. I'm so sorry. I don't want y'all to stop joining in just because every time you come, you're like, well, we always got to take a test, Dr. A.D. Young. But Tawny, tell us about this quiz.
So today, the big question is, scientists believe that COVID-19 is spread through which of the following? Is it through respiratory droplets that pass from person to person? Is it contact with infected animals or pets? Or is it food and contaminated surfaces? Or is it the final option, D, all of them?
So we're going to give you all a minute to ruminate on that. Think about what you think it is. You all are brilliant, so I know you know the answer, but we just want to put it in there because we're going to talk about ways that it's not spread. So.
All right. If you guessed A, you are right. Respiratory droplets that pass from person to person is primarily the way that COVID-19 is spread. Respiratory droplets that contain the virus, such as an infected person who coughs, sneezes, or talks, can land in the mouth or nose of people close by or possibly be inhaled into the lungs, causing illness. There's no evidence that pets play a significant role in the spread of COVID-19. While the virus can live on surfaces, touching contaminated objects is not thought to be the main way to transmit this type of virus.
Great. So it's respiratory, it's droplets. That's what we know. That's what the experts contend. It's a new virus. We're learning every day, but that's what we understand. But you all came here to find out something else, okay? I've talked to many of you out there. I've heard from many of you out there. You want to know.
Can you get corona from sex?
Yes, that's the main question. Can you get it from sex? So let's talk a little bit about coronavirus and sex, okay? So it's already established that we can spread it easily from person to person through contact. And we all know that it doesn't get much closer in terms of contact than sex, right? It's very hard to socially distance somebody that you are intimately involved with. So let's talk a little bit more about what the literature tells us about coronavirus and sex. Liz?
Right. So, you know, Harvard, we always respect what it is that they say. There's a blog that they put out that talked about how, you know, if you're social distancing appropriately and keeping your risk down, that it's probably safe to continue having sexual intercourse with your partner.
Probably.
Why do you say it like that, Davida? Tell us what you think.
Look, you know, there's always a risk. You know, it just depends on how willing you are to take that risk.
Right. And especially since we also know that there could be asymptomatic carriers, right? So Liz, you're telling us that the Harvard blog is saying if you know the person, if you are sheltering in place with them, if you're quarantining, it should be fine. But, you know, people are going out and about, even to things as simple as the grocery store. So you are taking some sort of risk, is what the experts say, when you have sex, because there might be an asymptomatic carrier, you know? Absolutely.
It says that some people that may have the virus, like you were saying, may not experience symptoms, but you are able to transmit this virus to other people if you don't have these through physical contact and intimacy. So
True. But we want to know from you all, and we asked you, like I said, we did a poll, almost 200 people responded. Are you too scared to touch? So in our poll, one of the questions we asked is, in general, are you scared to touch people during this coronavirus pandemic? And the vast majority of you said that you were. Some of you were a little scared, about 65% of you, but 10% of you are absolutely terrified. Okay. So this is something that we really need to address. Should we be feeling scared like this? What's going on? So another thing that we asked, and I just want to put up there, is we asked some people, are you scared to kiss and hug your kids? Are you scared to kiss and hug your elderly parents? And we found that the majority of people weren't really scared when it came to hugging their kids, kissing their kids, even if they were healthcare workers, because we did ask about that. But a lot of people, quite a few, were a bit scared about kissing or hugging their elderly parents. I know some of you live with your parents. Morgan, you live with your mom, or your mom lives with you, and we've discussed that a little bit about how you feel about kissing and hugging. What are your thoughts on that?
Terrified. I mean, I don't get too close. It's inconceivable to think that we live in the same house and we don't get too close, but I don't. You know, if I want to give her a hug, I hug her from the back, after I've taken my scrubs off, after I've showered, after I've done my due diligence. But it's scary. My mother is 75, so it is scary that I'm going to bring it home to her.
I hear you. Tony, we also asked our poll members what they said, and some of us gave responses about how they felt about hugging and kissing their elderly parents or elderly family members. You want to share with us what they said?
Yeah, so like you said before, kissing kids and children were not so met with so much hesitation, but the elderly, people are definitely a little bit more concerned. And I think that the media has a large role to play in this, because we've been seeing a lot of information about vulnerable populations and people spending a lot of time learning that the elderly and the young are at high risk. So it didn't really surprise me that much that the elderly, definitely people were being a little bit more cautious with them, just like Morgan and her family.
Absolutely. But Sonia, one of our members just asked something that has been on everyone's mind, kind of buzzing since the article came out. And that's about what?
So that is from the standpoint of can the COVID-19 be transmitted through semen?
That's right.
Yes. Hearing that, actually, I get asked that quite often from some of my, male family members, some friends. And so we did pose the question, have you heard that coronavirus has been found in semen? And so interestingly enough, it seemed like 51% said yes. So it's kind of 50-50. And 49% said no, that they weren't aware that that was a potential or a possibility.
So yeah, so it seems like half and half knew. Some people knew that it's in semen. Some people did not know that it's in semen. But the real really the more important question, I think, is, does it matter? So what we need to know is that the literature suggests that it may not, even though it may be in semen, it may not be infectious. And we'll tell you a little bit about what we've seen at When Docs Talk in terms of the literature. But a really interesting follow-up to that question is we asked our viewers, or the people who filled out that survey, if you did know that it is in semen, how has that affected your sex lives? Well, the majority of you said that it did not affect anything about your sex lives. 57% of people said, doesn't matter, business as usual. There were some people who said that they were having less sex because of that. 2 people who said they will never have sex again now that they discovered that coronavirus is in semen. And then a lot of them.
All the other stuff that's in semen.
Well, it was an anonymous survey, so we won't know who the less than truthful people are.
It wasn't me.
In the words of Shaggy, it wasn't me.
Right. So let's just quickly breeze through what this means for us. Liz, there was an article. Tell us about the article that talked about semen and coronavirus. Can you tell us a little bit about that?
Sure. It was in JAMA, so it was in a respectable journal. They did actually find coronavirus in semen, but as you said before, we're not really sure what that means. Is coronavirus going to be the new STD, the new sexually transmitted disease? We don't have evidence of that, but it's there. We don't know what it means, as was said before.
Okay. So what's the follow-up question? I can tell you that all of my male friends, when this came out, so my female friends were like, oh my gosh, it's in semen. And then my male friends were like, well, what about vaginal secretions? Is it there? Should we be worried too? Which is a fair question, right? So, Sonia, what have you heard about that? Do you know anything about that?
Even though that definitely is a definitive question because of the semen, there's not a lot of data really. But the Journal of Clinical Infectious Disease, they actually have published some data in which they had done a very small study on some women with severe COVID-19 pneumonia. They were admitted to the ICU, and so there really wasn't any evidence of it being passed into the vaginal secretion. So from that standpoint, right now, even though it was a small study, there isn't any evidence of it right now.
Okay, so it sounds like they didn't find it in vaginal secretions. They found it in semen, but we don't know if that means you can pass it through semen, and that's kind of where we are. So what do we know? Yeah, we see from Cheryl Penton, wow, I had no idea. Trust me, a lot of us are learning ourselves. And I see the horror face that you made there too. Don't be too scared. Okay. What we do know though is the following thing. There are some guidelines that tell us about how to make sex safer during the coronavirus pandemic. We want to share those briefly with you before we bring on our guests, because we do have some guests who are here to speak with you about their experiences with intimacy, and we want to bring them on. But first, I'd like to let you know that according to the American Sexual Health Association, you are your safest partner. They say that masturbation is really the only way to ensure that you won't get it, considering that they are asymptomatic carriers. And the next safest, of course, is someone you live with. You want to avoid close contact with those outside of your home and limit the number of sexual partners you have. The fewer, just like with any sort of communicable disease and sexually transmitted disease, the fewer is always the safer. Then also, I had to put this quote in because I thought this was hilarious. They literally wrote, if you usually meet your partners online or make a living by having sex, take a break. I concur. What do you all post your questions about it? Yeah, I have a good friend who is an epidemiologist, and he just posted that they're finding new evidence about it in different secretions. Thank you so much, all the way from Greece, Hodges, for tuning in and posting. Other guidelines by the American Sexual Health Association: avoid sexual contact with symptomatic partners. That's kind of goes to stand without reason. And then avoid kissing or exchanging saliva. Now, they're not saying don't kiss. They're just saying that these are some of the ways to make it safest, because we do know that it is in saliva. Another thing that they mentioned, which I thought was important, and I did mention, please, on the ads, this is not a show for children. So you want to avoid sexual activities which involve licking around the anus, because they have found it in feces and do believe that it can be communicated or transmitted, I should say, rather, that way. You also want to use condoms or dental dams to reduce the contact with saliva or feces. And so that is the recommendation. And with that, I want to bring on our first guest. I want to welcome Mr. Russell and Ms. Edith Kleber. They're going to be here talking to us a little bit. We're so happy to have them. Welcome, welcome.
Hi.
Hi, guys. Welcome.
Hi.
Thank you for having us.
Russell. Oh, we're so excited to have you here. So excited. And we're happy to see you all together. You're very close together. No social distance there, happily. Good.
For 18 years now.
I want to tell them a little bit about you, and then we'll jump into our discussion with you, because we really are honored and happy to have you as a married couple tell about your experiences, especially since one of you is on the front lines. So Russell is self-employed, and he was the owner and operator of a restaurant called the Coconut Grill in Norcross, Georgia. And they actually had plans to move it to Miami, isn't it?
Yes, I actually I went to Miami in December, twice in January, and I was about to go back in February. And then all of a sudden, that's when the early talked about it start. And I said, okay, let me pull back.
Okay. And then Edith is a registered nurse, and we work together actually. And so they actually been married for 18 years. They're the best of friends, and they're here to join us.
Yep.
Sonia, what do you want to know from this lovely couple?
18 years this weekend, actually.
Oh, happy anniversary.
Yeah,
May 26th.
Happy anniversary to you guys.
Thank you.
A blessing. So yeah, I just wanted to know from the standpoint, especially with you, Edith, working on the front lines, and I had talked to some other colleagues from how they had to change their practices from even when they're going home, from work and being, in close proximity to their family, their kids, as well as their husbands. So kind of share with us kind of what your ritual was, coming home from work, if you changed that.
So the ritual continues to be, I'll either come from the garage. Russell will either have some clothes laid out for me in the garage and change in there. I started going to work with my regular clothes and changing into my scrubs. Then before I go back home, I change back into my regular clothes. So we've tried a couple of different things, but it's always to not really have any contact with what I've had on when I come into the house. So it was kind of like the garage was my bedroom, home, and everything.
So did you feel like that made you feel a little bit better going in, being able to be in intimate proximity with your kids, your husband?
It made me feel better. I know it made Russell feel much better, because Russell was the anxiety. Being in the front lines, we kind of deal with those things all the time. And not that I wasn't afraid of COVID, I was, but when you have contact precautions, you put things on, and I'm used to having TB patients and all that good stuff. So it wasn't as if, but I know Russell, his anxiety was real up there.
Actually,
let me tell us about that, Russell. Yeah.
Allow me to chime in. When this first started, I'll be honest with you. I'm all about logistics and understanding how things operate and how to execute. And so when my wife first mentioned that, she came home and she said something to the effect of, she might have been exposed to a patient. This was way before the setup of the tent outside, like you guys have it. And so the first thing was like, okay, wait a second. So how are you guys going to execute screening those who are coming in? And one of the first things I thought about was like, okay, why don't they just put a tent outside? And I was just going through it and through and through, just trying to figure out, okay, so why don't they just close off all doors, put a tent outside where you guys are, and everyone comes in and out of there. And it was like, I was very happy that was one of the first things that you guys were able to do. And so my anxiety level started coming down. I was like, okay, good. So at least there's something at work that is happening to make sure that she's protected in a sense, and that we're able to make me feel a little more comfortable for myself and for the kids and things like that. So I was very happy to see that, to be quite honest. I was like, okay, you know what? I feel a little better now.
A little bit better, a little bit more ease. Okay, I'm going to ask you something that I really want to know. I hope you'll permit me. I want to ask both of you, what's changed intimacy-wise, if at all, since coronavirus hit?
I don't think much, to be quite honest. I think at first it was like the talk of, oh my God, what are we going to do? How are we going to protect ourselves? How are we going to protect the kids? Our system that we'd like to put in place at home when the kids come home from outside, whatever well, first of all, they're here all the time. But if we happen to go to the store, hey, as soon as we come home, the first thing we do is wash our hands and things like that, wipe everything down and so forth and so on. I think it was, to be quite honest, to a certain extent, it was more psychological in a sense, because in the end, you can have it, as I'm told, and not know you have it and pass it on.
So let me just interject real quick. So what I saw from my point of view, just being with each other, it wasn't the intimacy that we had, that didn't change at all. Like Russell was not afraid to touch me. I wasn't afraid to touch him. And we continued to be close. However, what did change was just our thought process and the scaredness, I guess, of the situation. So it was more so of, what are we going to do if this gets worse? What's going to happen? And, are we going to close ourselves off? It was more so closing ourselves off to our families and our friends who we love.
Yeah.
It was, so that was like a real stress.
And not so much to each other, but everyone else around you.
Yeah. Like, for example, like my sister lives, like, technically speaking, walking distance from here. And I'm we're very close to my sister and their family.
We haven't spent time with them.
None whatsoever. Like in the last 3 months. And we're like there like twice a week. She comes over. We bring food back and forth to the house and things like that. And it was more like, it was sad to see where on her and her husband's side, where they didn't allow anyone to come into their house, including myself and my wife. And I was like, at first I kind of took it, I was a little offended by it. And so I spoke to my wife. And I mentioned like, I don't know how to feel about this, because my sister and I were like the best of friends.
Yeah.
Why would you alienate me as if like I'm a walking virus or something like that? And
but you understood, though. You understood where she was coming.
Yeah, of course. I know. But I quickly shook it off, and that did not mean for me to if she needed something, I would just bring it to the front of her garage or leave it at the front door of her place. And if she needed me, I'm still there for her in a sense.
Great.
And it also made me feel bad, because I know that most of that was probably because of me, because I am an ED nurse and I get those patients straight on. So maybe if I wasn't, like who I am, it probably would have been a different story. And I get it though.
No, I agree with you. I do feel that healthcare workers, the way that people perceive us, people are wonderful. They congratulate us. They're so grateful, and there's an outpouring of love, but there's also a fear. I mean, I know that my kids, if they do play dates, my kids might not be the ones that they ask to come, because they know what their mom does. And there are times where I have faced other sort of mini discriminations because I'm in healthcare right now in the age of coronavirus, but that's fine. I want to ask you another question before you all leave. I wonder, because some people have speculated that actually this virus is bringing families, nuclear families, closer together, because they're there all the time. The kids are there, everybody's there. Do you all see that in your household?
Absolutely, most definitely. I mean, I'm baffled by the conversations that my daughter and I have, my son and I have. I feel like this an amazing bond. She's like trying, she goes on YouTube learning how to cook new things. And she's like, Dad, I want you to try this. I'm making you breakfast. I'm like, oh, okay, cool. Actually, even now, what was it, yesterday or before yesterday? My son reminded me of a book report that I gave him on George Steiny Jr., and it's amazing how he remembered that. And so he wanted to just share that with me. He's like, Dad, remember that book report you gave me? And we started talking about what's going on nowadays and with all the rioting and things like that. So it's amazing the conversations we're having right now.
I know with me right now, because I'm the one always leaving, and that has caused a little bit of anxiety on my part each time. So I kind of want to be here all the time with them. Yeah. So that's like a little stress that I'm dealing with each time. I'm like, oh my gosh, you just want to kind of be with your family and be here talking about bunkers and, shutting your life out and shutting the world, it's a little stressing, when you go to work and you're caring for everyone, and there's always that fear of, do I have it? Am I going to bring it back home? And did I have it? Because we both feel like we had it before.
Oh, really?
Yeah, we were so sick.
I was the first one that got sick.
He got it first because, again, he was traveling back and forth to Miami, and we're always in close quarters. And then I got sick, and it was early on when it wasn't really like a big thing. And, we both kind of made it through after 3-4 weeks of just, being ill. So again, it's that fear of, okay, what are they saying? Because, researchers, there's so many contradicting things. Like, you can get it again. You have the antibodies, you can't get it again. And my daughter, had asthma. So I'm like, so that's always in my heart. Like, am I bringing this thing home? Am I doing enough? Am I washing my hands enough? But then, you feel suffocated with the mask and you bring it down. It's like, oh my God, it's just so stressful.
It's stressful. But you know what I'm happy about? I'm happy that through all the stress and all the precautions and your job and his job and everything, that you're still fostering those family bonds, that you're not scared to touch each other, that intimacy is there, the love is there. Congratulations on 18 years. Thank you all so much for coming. We appreciate it.
Thank you for having us. We really enjoyed it.
All right. We're going to go ahead and wait for our next guest. Please stay tuned. You're watching When Docs Talk. All right. Hello, Morgan.
Hey.
We have a special guest here with us. Why don't you tell us who we have here?
Well, I have the pleasure of introducing Mr. Everett Moss, RN. He is a nurse. He's a former flight medic, and currently he's in school to be a CRNA. Welcome to the show, Everett. We're glad you could make it.
Welcome. Welcome.
Thanks for having me.
So, all right.
Go ahead, please. I know you had a question. I'm anxious because I heard something about him, so I want to ask my question, but you get in there first.
Okay, Everett. So I understand you answered the call. You went to New York City and you helped out on the front lines during the COVID crisis. You came back not too long ago.
That's right. I got back almost 3 weeks ago now. Tomorrow make 3 weeks.
Okay. And my question for you is, I know coming back home, Everett is married and he's the father of 3 children. And I know coming back, I believe it was a concern for your family as to how you were going to quarantine yourself after being in New York for a while. Tell us a little bit about that. What did you do to ensure your family was safe?
Well, thanks to the American Association of Critical Care Nurses and the American Express, they were able to partner with the Hilton hotels and offer free hotels for frontline workers that were traveling to or from these assignments. So because of the concerns that my family had, more so my extended family than my immediate family, we decided to get a room for a week to allow that incubation time, if there was going to be any, and to see if I would be displaying any signs of symptoms from COVID. So that's the precautions that we took. I got a room for a week after returning. It actually ended up being a little longer than a week because I didn't have any patient contact a few days prior to coming back.
Okay. You're actually the second guest on our show who has had a family member or been the family member who called or basically heeded to the call of New York and went there. And I'm just curious what kind of decisions or what kind of thought process went into that decision? What made you feel like you definitely had to go out there to New York and help out the hotspot?
So a number of things, given my background as a firefighter and paramedic, hazmat tech, I've always been in a position to quote unquote answer the call. And I also was transitioning from my regular jobs to PRN roles, being that I'm going to CRNA school. So I was already considering taking contracts, but of course they were going to be local. And one day I was watching an Instagram story where I saw all of the firefighters outside of the hospital clapping and cheering as the nurses came in. It was like the switch went off because of my close association with the fire service. Seeing that was a huge motivator for me want to go and answer the call and offer the experience that I had.
Were you scared at all? Was it like boom, 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 boom?
Yeah, you know, it's hard to say I was scared. I mean, when you were 19 years old, running and burning buildings, and you know, putting on hazmat suits, going into unknown substances, you know, that's frightening. So this, though we don't understand a lot about COVID, I feel that I have the necessary protection so that I don't have to have that fear. Fear of the unknown is always a factor, but I mean, you know, it gets not much worse than running into a burning building.
Right. Was your wife scared? Do you get the sense that
Absolutely.
your wife was scared?
Yeah, absolutely. My entire family was scared. You know, I had cousins, my sisters, you know, calling me nearly daily, you know, like, take care of yourself, I'm scared. You know, the thing is, I think what people in our region and our area where we are currently working, you know, that fear isn't there because they hear about the epicenter, but they don't think about the fact that prior to going to New York, I pretty much had a COVID patient every day. Right. You know, it's just the sheer volume that's talked about in New York that made it much more frightening. But all in all, you know, I think they also had a lot of confidence in me and my ability as well.
Great. The last question I want to ask you, unless our viewers have any questions, is what was the first thing that happened when you walked back in the door and were reunited with your family?
So actually, before I actually made contact with them, they brought me, I guess, a care package by the hotel and dropped it off at the front desk. So, you know, it was a lot of waving from the doors of the hotel. But of course, everybody was happy to see me. I had never been away from my family that long before, so it was a good reunion.
Awesome. Who was the first person who touched you?
My wife. My wife saw me before because I actually saw her before we went to get the kids.
All right. Well, we thank you for your service here in Atlanta and also for going out there and heeding to the call. We're happy that you're back and safe and reunited with your family. Thank you so much for being one of our guests.
Thank you, Everett.
Thank you. Y'all have a good one.
So speaking about healthcare workers, okay, we asked in the survey for healthcare or frontline workers, are you isolating from loved ones because of coronavirus? And we found that most were not. Most felt comfortable enough as long as they were safe. We had some comments saying that they just took extra precautions. We also asked our survey respondents, are you less interested in having sex with a healthcare worker? Well, the good news is people are still trying to deal with you if you're a healthcare worker. So only 34% said that yes, they were less interested in having sex with someone if they were a healthcare or frontline worker during the pandemic. 55%, almost 56% were very comfortable. And with that, I'd like to wait for our next guest to join us. And I see that we have some viewers watching all the way from Nigeria. Thank you so much for joining When Docs Talk. All right. And we are back. Welcome, welcome. So we are joined by this lovely lady, Macarena Correa. Hello, Macarena.
Hi.
Macarena is a dear friend of mine. Actually, we go way back, all the way to college. And so I'm so happy that she's here as a guest on our show. She joins us from Milwaukee, where she works as a social worker. And her background is in education and psychology, where she holds degrees from Harvard University. She's also interested in spirituality and actually spent years as a Trappist monk. I would love for her to talk to us a little bit more about that. She's currently in a relationship, and she's grateful to live near a little park where she goes to get a breath of fresh air during tough times like these. Macarena, welcome to When Docs Talk.
Thank you. Thanks for having me.
Thanks. I don't want to be greedy and jump in before these other ladies because I know you and I know they want to get to know you. So I will let either of you ask Macarena whatever is on your mind.
Macarena, tell us a little bit about what your relationship is like. I'm always the nosy Parker one in the group, so.
Well, I've been in a relationship for 8 months, probably 9 months in a few days. So it's been a little while. And yeah, you know, Dee Dee asked me to talk about how it's been different since COVID. It definitely has. So if you have any questions about that, I'll try to answer them for you.
I do. How's it different?
Yeah, what way is it different?
Well, the big question, and I speak for myself, I can't speak for everyone, but to isolate or not to isolate. Because, I like human contact. I'd love to be able to talk to my colleagues at work. I'd like to be able to talk to my friends. I don't. So during the week, I don't see anyone at all. So on the weekend, do I see my boyfriend or not? Because maybe I exposed myself this week. Maybe he exposed himself. Should we get together? So it's always that trade-off. Do I want to spend another couple of days without any kind of even interaction at all? Or do I want to risk it?
How is he taking it?
I'm sorry?
How is he taking that? Like, how does he
that's one of the questions I have for the show. I don't know if it's my demographic or the people I know or what, but I'm wondering if there's a gender difference in isolating. I just find that the men don't seem to care. Like, they're still hanging out, they're still getting together, whereas my friends would die if I asked them to hang out. They're like, no way, I'm not leaving my house. I just feel like women are much more conscientious about maintaining their social distancing. And so
that's a good observation or a good thing to speculate. I don't know. I mean, maybe it depends on the men. I know that my husband, he doesn't try and go out. He tries to be careful, but I don't know if it's an age thing, if it's a men thing. I don't know. That's a good question. So you're saying your girlfriend's not meeting up with you, no touch?
Oh, not at all. Yeah.
But his friends
been doing a good job with the isolation. They think I'm crazy. Like, I know, Dee, you probably think I'm crazy. The first time we tried a video chat, I was like, I'm busy. You're like, what the heck are you?
Like, where are you going? It's a quarantine. You haven't heard? Where are you going?
Where are you? Right.
Macarena, I don't know if you're familiar with the book, The 5 Love Languages. And,
I am, yes.
It's one of my favorite books. But, the love language, physical touch, I've noticed that many people whose love language is physical touch are struggling with social distancing right now.
Oh, yeah.
And I think I've heard that the percentage of men who have that as their primary love, or the percentage of people is much higher in men. And so I wonder if that has something to do with, them being like, no, we're just going to take our risk when it comes to coronavirus. So
I think in keeping with what you're saying, there's a person on our chat who just battle talk, who just said he's not social distancing. And I'm assuming he's a male, but he just said, I'm not social distancing with my lady. I'm on top of her.
Right. Okay. Battle.
Okay. That's pure honesty, and that's what we want. We want to know what's going on. Macarena, when you and I were talking before, you mentioned that there's a lot of your friends that are struggling and having breakups or having strenuous relationships. Tell us a little bit about that.
Yeah, I have one friend who's, dating long distance. And so part of that, if you're trying to remove the relationship forward, includes visiting each other. Otherwise, how are you going to get to know the person more? Do you want to keep going? Is it going to get more intense? And that's been cut off for 3-4 months. So let's see, March, April, May, June. It'll be 4 or 5 months, almost half a year since they've seen each other last. And so that's been a real strain, trying to keep the relationship going with no kind of interaction besides, the video chats and the texting and if they want to move forward, if they want to get serious, how do they know without being able to spend time together?
Right. We actually asked some of our viewers about that. We asked them in the survey if they've experienced a breakup, and by and large, most people hadn't experienced any breakup. You could see it's almost 90% roughly that said that their relationships, if they had them, were intact. Macarena, I have to ask you, there's just no way I can let you go, even though I know we have to move on to our next guest. I want you to tell me a little bit about what touch looks like, especially given the fact that when you were in the monastery, is it? There was a vow of silence that you took. There was not a lot of interaction. From that perspective, from someone who's lived that life, tell me what touch and intimacy mean to you.
Right. You would think I'd be better at social isolating after being in a monastery where you can't talk. I'm not. At least in the monastery, there were people around, and maybe you couldn't interact with them, but they were there, and you're part of a community. I think that's a basic human need to belong to something. And those of us who live alone and are under quarantine, we're not belonging to anything right now, and it's tough. It's really tough. I think there's something very human about being around other people. And those of us that live alone under these times, it's very stressful, very anxiety producing. It's sad and it's lonely. So there's a lot to be said for that, because even if you can't talk to someone like I couldn't in my situation, at least they were there. At least they were present. In fact, sometimes they got on your nerves because, a lot of people in a small space, you wished you were alone sometimes. But now I guess I'm eating my words because I am alone and it's rough.
Yeah, I think a part of it is people maintaining the ability to choose.
Right.
So even if you have friends and you have family, you want to be able to say, you know what, I don't want to go out today. But now you can go out today. And they take that choice away from you.
Absolutely. I was talking to a formerly married woman recently. She's been divorced for quite a while. And she was so happy being a single woman. She just didn't feel any lack. She was active. She had a community. She had friends. And now all of a sudden she's starting to rethink, like, oh, should I try to date? I mean, should I try to date again? Should I rethink this? I mean, she didn't sound too eager, but the virus was bringing out these big questions that she thought she had resolved already.
Right. Well, Macarena, I really appreciate your perspective as somebody who's in a relationship, somebody who has been in situations where they've been in somewhat isolation or at least removed from touch. And as a dear friend of mine, thank you for joining When Docs Talk today.
Thank you. Thanks for having me.
Yes. And I see here a comment all the way from Greece. It says, because I would argue we haven't seen in our soil what happened in Italy, and perhaps because we had a proper lockdown, which people respected through March and April, and thereby now we have lockdown exhaustion as we have phased out the measures. People are much more relaxed. I agree with you, Hodges. I'm seeing that too. Now, speaking about relaxation and speaking about relationships and so forth, I want to, without further ado, bring up our next guest. She's actually just going to tell us a few words about a project that she's working on, a business that she's starting. We're talking a lot about relationships, and most of the relationships are making it through coronavirus, but not all of them are. We would like to introduce Gloria Billingsley. She is an entrepreneur. She is a young lady. She's single, and she wants to tell us a little bit about her breakup box. So please welcome Gloria. Gloria, how are you doing? I think you're on mute. Yes.
All right, can you hear me now?
I can hear you now.
Oh, perfect. Hi, I'm so sorry. I'm new at this.
It's no problem. Welcome to the show. So tell us a little bit about the breakup box. What is this?
It's actually it's a purchasable, tangible, physical item that you can actually purchase to help you process a breakup. So it's really a hands-on chemistry set for a breakup.
Okay, wonderful. And I know that you and I are going to have a little bit more in-depth discussion. If you want to hear more about the breakup box, go ahead and go to our YouTube channel at When Docs Talk. You'll hear Gloria and I talk about what's in it and how it's helped. But just tell me before you leave, what's your most favorite product within your breakup box?
Oh, only one?
Only one. Just one. Favorite.
My favorite item in the breakup box would have to be the manual, the breakup manual.
Okay.
It's a step-by-step. Oh, I just wish I could give more details, but in the conversation that we're going to have, we're definitely going to include that. So.
Wonderful. So go ahead and check out When Docs Talk YouTube channel. Subscribe. 100th subscriber will get a free breakup box. You don't have to use it yourself. You can gift it. Yeah. And you'll find out what's in the box, why it's helpful, Gloria's journey towards becoming an entrepreneur and coming up with this idea, and how you can get your hands on one. Thank you so much for joining us, Gloria.
Thank you so much for having me.
All right. See you soon. We'll be back with our next guest soon. Okay. And welcome back to When Docs Talk. We are here with our next guest. I see him here in the middle. Welcome, John.
It's a pleasure to be here. Thank you for having me. I feel honored.
Oh, it's an honor to have you. So let me tell you a little bit about John. John Myers. Yeah, only good things. Don't worry. Don't be nervous. John Myers is a Christian counselor and relationship expert here in the Atlanta area. He has written a book called Hey, Can We Talk? And what I think is very enlightening about his whole approach is that he often focuses and seems to really respect the value of touch as a way to foster intimacy. So we're happy to have him here on this show when we're talking about marriage and sex, dating, and intimacy. He is also married and a father of how many, John?
3.
3, and a grandfather of?
5.
5. Wow. So we are so happy to have you here. And Sonia and Davida are here too. I'm sure they have some questions they wanted to ask you.
Well, I just wanted to know from the standpoint of definitely touch is one form of intimacy, but I think from the standpoint of even in just discussing social distancing, what are your thoughts on different types of intimacy, like intellectual intimacy, aesthetic intimacy, just those different forms? Is there some discussions that you have with the people that you counsel?
Right. Where the concept comes in, it's got to be based on communication. Everything has to start with what I believe is communication. Mm-hmm. And when you mention intimacy for a man is a lot different than intimacy for a woman. So many women make a mistake when they say, I want intimacy. And for a man, intimacy means sex.
Mm-hmm. Oh. Yes.
Now, what happens with...
Yes. Go figure.
But what I tell women is you're fighting against a DNA. And that's the way our DNA is designed. So in many situations, a man starts with sex and works his way back to intimacy. A woman starts with intimacy and works her way to sex. What we have to learn to do now is how to meet in the middle. And meeting in the middle means I have to be able to communicate with you so you can feel 2 things. And at first I thought this was just important for women, but now I believe, and I'm finding out it's just as important for men. You have to be able in front of your spouse to feel emotionally and mentally naked. Mm-hmm. And what that means is I can tell you anything. Mm-hmm. And you won't look at me like I'm stupid, I'm crazy, I don't know what I'm talking about. Because if I can share anything with you, we can take our intimacy to levels that's unbelievable.
Yeah.
But if I can't share anything with you, then I'm limited on what I can say. So this teaches both people, husband and wife, to say, what's on your mind? I'll listen to it. I don't have to agree with it, but you just have to know that when you stand in front of me, it's a peaceful area. There's no conflict. We can just talk. You can tell me the craziest knock-knock joke, the weirdest story you've heard, and we can laugh together. Now you're teaching me how to be intimate your way, and I'm going to teach you how to be intimate my way. So we're learning each other. But if we come before each other and I say something and you put me down, that's male or female, tell me my idea is stupid or all these things, now communication messes up. We just have functions. Mm-hmm. I'm just functioning here, you're functioning here. We may function together, but we're missing that intimacy.
Right. How has coronavirus affected intimacy? How do you think, as somebody who counsels couples, mm-hmm. how do you think that this pandemic and the isolation that a lot of people are feeling has impacted relationships and intimacy?
Well, what it has is it's actually brought out a lot of things, and it's shown couples we built our marriage on the wrong thing. Mm. And now it's forcing us to go back, tear down that false foundation we have and rebuild it on a better foundation, which is you and me. I didn't build it on I may have built my marriage on my ego for my job. You know who I am. You know what I've achieved. You know what all these things. Now I can't get to those things. It's me and you now. Mm. Now we have to go back and say, we built it on this fallacy. We got to throw this out of the way and let's build it on you and me. Now,
do you think it affected your marriage?
Say again?
Do you think it affected your marriage?
Good question.
Did it affect mine?
Yeah.
No, mine was built on craziness from the jump.
Glad you knew.
I tell people, I'm not a normal counselor. I don't. You come and some of my clients can tell you, if you come to me looking for normalcy, we're going to throw that right out the door when you walk in, because I believe we have to hit it where the problem is and be realistic. That's my opinion. Individual results may vary. Please consult your savior before attempting this at home. So I believe we hit it from the fact of what's affecting you, and it's this. And as I'm starting to learn more and more, that communication is so important. And my marriage is built on craziness, weirdness, and sense of humor and comedy, and that's me. So I'm not normal.
Okay. How can, but you know what? We appreciate that quirkiness and that out of the normal. I want you to drop one more thing on our viewers. I want you to tell them, I want you to give them advice. How can they manage intimacy through this coronavirus season? And I'm not just talking about married couples, John. I want you to talk to people who are dating, who are looking for love, who are looking for that physical touch that in many cases they can't have safely during this time period. What's your advice?
The advice goes the same thing. There's a place in this world called Earth. And what we need to do is move back to Earth. And here's what I mean. Men have taken on the image of, I have to be super tough, super this, super that. There's no place in scripture where I'm called to be strong, but I'm called to be strong in the Lord. I'm called to do strong things. I don't have to be this great macho tough image. What that does, I'm building a house on a false foundation. It's okay to be human. It's okay to say, I'm stepping in this relationship, babe, I'm gonna make some mistakes. I may make them over and over again, but I guarantee you, if I make 15 mistakes this week, I'm going to make maybe 10 next week, and I'm getting better. It's okay to be human, to try and make mistakes. Not only are men picking this up, but women are picking it up also. Now women are stepping in saying, I got to be better than this man. I got to be better. And it's turning into a competition rather than we can work with each other. Now we're competing against each other. So to help you in the virus, just be human. Be able, and this is where I went back to earlier saying being emotionally and mentally naked, it's being able to share with each other and say, hey, babe, I'm afraid. Baby, I'm nervous. Baby, I'm upset. It's for a grown man to walk up and say, hey, babe, so-and-so hurt my feelings. I'm okay being human. I had to learn that. With 24 years of Marine Corps service, we practice being tough. Yeah. And the hardest thing is now to come back and say, like some little kid, you hurt my feelings.
Right. But I guess it's a little bit more like that spiritual level of intimacy versus the physical intimacy. And that if you're able to build up that spiritual communicative type of intimacy, all the other stuff maybe will fall into place.
Yes, because you're building it on a better foundation. So now we can build a second story, third story, fourth.
Right.
The other thing with intimacy that we miss is the more we demonstrate that me and my wife can communicate, we teach our kids the type of man they should marry or the type of man they shouldn't, the type of woman they should marry and the type of woman they shouldn't. So we also affect our generations down the line because our kids see us, how I see how you treat my mom, I see how you treat my dad. I want a woman like that, or I do not want a woman like that. Right. So this is the importance of that communication. My dad can go and tell my mom anything and she just look at him and go, yes, dear. Or my mom can tell my dad anything and he'll go, yes, dear. They can always tell each other stuff and laugh with and at each other rather than throwing the name calling out. So that in this COVID-19 era is forcing us to strip away the fallacies and let's get to reality.
Yeah.
Yep.
Say again?
I said, I hear you. I appreciate these gems you're dropping.
Yes. I appreciate them too. John, you are always a pleasure to talk to. I really appreciate you coming on, sharing your perspective from somebody who not only has a relationship himself, but also deals with many people in relationships and bringing that male perspective. Sometimes we miss the mark as ladies. We don't always see it that way. So thank you so much for coming, for your advice. And we hope you'll be back on When Docs Talk for another show.
Yes, wherever you need to call. For you, the world.
Thank
you.
You're quite welcome, ladies. You're welcome.
All right. We want to bring in a singles perspective, find out what's going on in the world of dating under the age or in the age of coronavirus. One of the questions we asked you all out there was, if you are not married or in a committed romantic relationship, are you having more or less sex. Unfortunately, many of you had to respond less. I don't know how you feel about that, but we're going to bring out some guests to talk about how they feel, how dating is. We also asked our singles who are healthcare workers. Healthcare workers, since the coronavirus pandemic started, are your romantic partners scared to kiss, hug, or have sex with you? Well, one of our respondents was very open and said that her favorite hasn't been, you all can read, so I'm not going to go there with because he claims he is scared. That is very real, my sister. So it seems that there are some healthcare workers who are striking out because of fear. Without further ado, let's bring on our next crew. We're going to have Cole Scotty and Josh Neville join us in just one moment. All right. Welcome.
Hey, y'all. How we doing?
Hey.
Great.
I just have to mention I like the pictures, okay?
You want to put them back up there?
Take a moment and look at them.
I can do it because those are very handsome men we have here. I'm going to go ahead and put it out there. Cole and Scotty, welcome.
He had to go and show me up in the tux like that.
If I would have known, I got some tattoos real quick, man. We'd have been matching something.
Hey, man, next time.
Let me introduce you all because everyone knows the rest of the ladies here. But Cole is a physician's assistant here in Atlanta. He and I actually work together, and we're so happy to have him here. He's an Atlanta native, I believe. Is that correct?
Correct.
All right. Welcome, Cole. And Josh Neville is a singer for a local hard rock band known as G-Bad. Is that right?
Yes, ma'am.
Yes. He's also a personal trainer, a model, and he's a salesman of vitamin supplements. And I can tell you that we are all here and viewers out there very happy to have you here to talk a little bit about what your lives have been like as single men in the coronavirus era. So I'm gonna sit back a little bit and just let y'all people talk about what that looks like. Because I know Tawny looks like she's about to say something.
Let me jump right into it. So I know that, and EP and I have talked about this before, that in the era of pre-corona, let's call it pre-corona, dating was a completely different dynamic. So you had lots of tools at your disposal. So you had online dating, you could pick up people at bars, you could go out, you could hang out. And I feel like post-corona or inter-corona or corona active, I feel like things are very different. And I've been talking to a lot of my single girlfriends, and I feel like some people are still holding on to the online social media, kind of trying to reach out to people and try to get into dating, and even dating in virtual places separately. How has dating changed for you guys?
You want to take the lead? You want me to grab it? I'm good either way. At least for me personally, like at the very beginning of like all the outbreak of it, because a lot of the time, media potentiation of like, I guess for lack of a better term, fear, it was kind of like, okay, I had a friend of mine that, and that was probably the way to say it. I have a friend of mine that we would occasionally meet up and everything like that. So at the very beginning, when things were kind of like, okay, how extreme is it that we just got through World War III happening? Like, okay, how extreme are we doing this? And then, we stopped talking and everything, but then everything locked down. There was barely anywhere to go. A lot of the dating apps and everything, you really couldn't really do much of anything. But even in the midst of it, it's actually been pretty positive for me on the opposite end, just in the weird fact that I feel like, rather than to go and hook up at a bar or something like that, where there is that opportunity for it to just take a carnal nature to where it could just be, for lack of a better term, just a hit it and quit it type situation. It alleviates the potential of that. So it's like I've actually.
Are you doing a lot of like, how are you dating? Like, I know that seems like a dumb question, but in certain contexts, how are you dating? Are you going to the park? What are you doing to get to know this person?
Well, in all honesty, things are being taken very, very slow in the current situation, but amidst just conversation, just because obviously we couldn't meet up before things started slowly opening and everything like that. Like, I actually have kind of met someone amidst all this pandemic, and with that being said, it kind of forced us into a situation of in-depth conversation, really kind of shooting candid, getting to know each other, really taking the investment to like, who are you? What are you like? Would we be compatible in real life? And once some things started opening up, we would go up to, I think it was just a little local restaurant where they had like all the different precautions in place, which, you know, we followed and all that good stuff. But it was that, does the chemistry translate in person? And having gone into it with that kind of vocal intimacy that had already been created, it was lightning speed. It fast forwarded so much in that
You
aspect.
wear masks?
Actually, no. We did not wear masks at that, but we did have all the different. You could sit at a table that didn't have an X on it. So
that's amazing. Cole, tell us what it's looking like for you.
Mine is I'm on kind of the opposite end of that spectrum. It hasn't been the best for me because, as you guys said, you know, you can't go out to bars, you can't meet people that way. So I've kind of tried to pick up the whole online dating thing a little more. But if I didn't have confidence in the online dating before, I kind of don't now. Because as Josh mentioned, now we're forced to have those deeper conversations with people. And it's kind of, you find out a little faster that, no, there's not much depth here. So I don't think that, you know, we're gonna talk much longer. It definitely takes someone you're really interested in for you guys to kind of make it through that phase where you can't go anywhere and we can only message. And especially being a healthcare provider, I do run into those women who are, you know, scared about meeting up or being in the same area as me. So it's not been the best for me, but you know, this too shall pass.
Okay. Well, talk about meeting up. Anybody, throw it out there. How are people dating? Morgan, you had a story that you were going to tell me about a friend of yours, right?
Yeah, actually, interesting. I think Cole mentioned walking in the park. I had a friend who met someone online, and in the midst of this whole COVID situation, and she'd been talking to this person for a while, and they decided to meet up at a park. Something that was like real old-fashioned and traditional. Something that, you know, a lot of people today, if COVID wasn't going on, they wouldn't do that. They'd meet at a bar, they go to dinner, you know, but they decided to meet up at the park and take a walk, and they wore their masks. So they did have their masks on, you know. Initially, of course, she said they didn't have their masks on because they, you know, wanted to be able to see who each, you know, see if they look like their picture. But they did, after the initial meeting, they walked with their masks on and sort of kept the 6 feet to arm's length distance while they were walking. And she said it was really neat because it was just like really old fashioned, and there was something that really felt good about it. Is how she explained it to me.
Sweet. You had me into the 6 feet, okay?
But wait a second though. So we're talking about, you know, walks in the park and meeting at restaurants once in a while, but like, I imagine that a kiss nowadays, you know, is like a big going all the way. It's like going all the way. Like, tell me about how intimacy advances in the world of dating during coronavirus.
Who would have thought you would have been scared to kiss someone? That's what I'm saying.
Well, by show, are we scared to kiss? By show of hands, who's scared to kiss? Like, if you meet somebody that you're really vibing today, who's scared to kiss? Davita?
I'm scared.
Morgan's scared to kiss. Cole's like, I guess it depends on how she looks.
Right. We gotta use some other.
Josh is like, nah, I'm not scared. I'll kiss.
You gonna hold hands.
Josh, you're not scared?
No.
And then wash your hands.
We stay hygienic and we stay taking vitamin C. We immunity boosted in this.
Wonderful. What do you think it's going to look like for singles? Like, do you feel like people who are single are feeling frustration? Do you feel that they're feeling hopeful now that things are opening up again? Like, what are people feeling in terms of dating and finding love because of coronavirus? I mean, I know it's always a struggle, but I'm talking about in the era of coronavirus, what's the overall mood? Everyone give me something.
I think people are reverting back to their exes.
Oh, really?
Yeah.
Oh, really? Yeah.
I know so many people.
Speak for yourself.
Many people.
Okay, Josh agrees with me.
So many people have hit up their ex.
Like meeting new women. Have you tried to talk to your old exes?
Actually, I haven't. I haven't reached back. But
Cole, you're nodding your head. Yes, you reached out.
Yeah, it happens. You get weak out here in the era of Corona stuff.
With the side eyes.
I mean, I guess if you're
No,
comfortable, you have a general idea of how they move and how they roll and whether they'd be careful or not. So it makes sense. It makes sense. We actually had a poll question that we asked our viewers. Have you been hearing from your exes or people who didn't seem that into you before the pandemic? All of a sudden, are you hearing? And there were quite a few people that said that people are coming from out of the woodwork all of a sudden, trying to get back in. Right?
Well, I mean, it's a noticeable difference in the accumulation of thirst trap, and that is definitely happening online right now. Like, come on, come on, people out here trying, they fishing.
That's true.
Great. Well, we just wanted to have this discussion because we talked a lot about relationships. We had married couples and so forth. We want to know what it looks like for you all. So we really appreciate your candor. We really appreciate you coming out there. Is there anything else you want to share with us or, talk to us about dating, looking for love in the age of coronavirus?
Well, just to your prior question about where do I feel this is going for singles, I think that as humans we're pretty forgetful. So I think that in a few months that people are just going to be back out there and we're going to kind of continue on attempting to date in the same way because we need to connect. And if for no other reason, people like myself, we've been in the house and we're like, I need that connection. So we're going to jolt back out there and try to find that person.
I hear you. All right. Well, thank you guys for joining us, for sharing with us. Good luck out there. Be safe out there. That goes for the guys.
Josh, wear your mask.
Wear your mask. Mask or like the new bears as like condoms, like mask.
Right.
They even got them like fashionable now. They even got them all the way fashionable now.
True. Right. Like brand masks. Thank you so much for joining. Well,
thank you for having us.
Take care. So before we close out, the main question we wanted to know from most of you out there is, do you feel that coronavirus has significantly impacted your sex, love, or intimacy life? We asked this to married people, single people, men and women. And the good news is that by and large, you all did not feel it did. 55% of you roughly thought that your lives were pretty much the same, but almost half of you felt that it had. Almost half of you felt like there had been a change in the levels of intimacy and sex and love in your lives. And it just drives home the point that touch is very powerful. Jan Phillips tells us in The Divining the Body, of all the gifts we can give to people, the gift of our touch is one of the most priceless. Through our hands, we convey a kind of radiance. A warmth seeps out from our inner fire, a wrap for someone's chill, a light for another's dark. Touch is very important, and we recognize that, and that's why we wanted to have this show. Now, before we leave, we wanted to drop some take-home messages from our host. Let's see if we have everybody back here. There we all are. Ladies, what are you leaving with? What are you dropping with our viewers before they leave? Morgan, what you got for them?
Don't get comfortable. It ain't over.
Okay. Davita?
I think that intimacy has changed for me because my dad had open heart surgery. And I work in a field where I'm in constant contact with positive patients all the time. And I think that, I'm really affectionate with my family, and just having to refrain from that physical intimacy with my loved ones has been a lot, but it's for the better, and I would rather sacrifice the touch than their health. So like Morgan said, it's not over yet. So still try to maintain that sense of caution with trying to interact with other people.
Fair enough. Tawny, what are your thoughts?
I think I want to just emphasize that safety must come first. I think in this era, and considering everything that's going on, sometimes some of our personal interests and motivations have to be put to the side to put safety first. And I just want to emphasize that to everyone, whether you're single or you're married, that those issues should take precedence.
Great. Liz, thoughts?
Yeah, I really resonated with what Josh said. He said, that now that we, the way the world and things are, we have to slow down. And I think we have to be more creative about how we pursue intimacy, and, not just in a relationship, but in friendships, go back to writing those letters, go back to care packages, go back to calling people that you otherwise would just see, you know, and I think it actually presents a good opportunity for us to explore a different kind of intimacy.
That's awesome. What about you, Sonia?
So I know for me, just growing up with my grandmother, she was a hugger that cured everything, healed everything. That it was just a beautiful thing. And I'm a hugger, so it's very tough for me, you know, and you know, being around my colleagues and family. But one of the things I know for me that I feel like has come out of this is my prayer life has gotten much stronger. You know, I feel like I have to admit sometimes, you know, people are like, you know, I'm like, oh, I'm gonna pray for you, girl, that kind of stuff. And I forget. But actually now, because I'm not able to be, I can't touch them or hug them, I really have made, my prayer life has been a little bit different. And I can really say now that's my form of intimacy to a certain degree. I feel like I'm praying more. And being a little bit more faithful. So that's one thing I think people maybe can think about doing. Maybe just praying for others.
I love that. I love that.
Yeah.
I definitely feel you on that. I would say this. In the beginning of this pandemic, let's go all the way back to like early March. My thoughts were very different than they are now. For a very long time, I was frightened of being the one to bring this home to my family. So I wouldn't kiss my husband on the mouth. My kids, I still really don't kiss them on their face, just in case, because I'm just horrified of it. But I have found that as the restrictions have loosened up, my heart has warmed, and my absolute need to be affectionate with the people I love the most in this world has overcome any sort of fear. I think the more we learn, we're becoming less fearful. And so, you know, I think we should trust the medical literature, but also trust your instincts when it comes to affection, because that is a very vital part of our lives. I always tell some of my friends, I think I'd go a little mental if I had to isolate myself from my family, seriously, because they are my wealth, they are my strength, and I love them. So my advice is to do the right thing to protect yourself, but remember to love and show that affection in any way possible and safe, whether it's touch, whether it's letters, whether it's prayer. I love it all. Be kind to each other. It's a lot of rage. It's a lot of isolation, a lot of confusion and anger out there. And with that, we have to be kind to each other, even if we can't touch. We have to find a way to make our eyes and our words show the affection that we might not be able to give.
Yes.
With that, I want to remind you all to join us next time, June 13th. We are going to be talking about racism, medicine, COVID-19, and the law, the intersections between them all. It will be sort of a town hall style. We want your thoughts. We want your opinions. We want your sentiments. So definitely don't miss that episode. Please check us out on Facebook and on YouTube. We have a YouTube channel. Subscribe to the channel. You'll get updates about what we're doing. And thank you so much. Thank you for tuning in. Thank you for listening. Thank you for your thoughts, for sharing. Thank you to all our beautiful guests and hosts. Y'all are the best. Love you all. Stay well. Thank you for joining When Docs Talk. We'll see you next time.
Bye.